I was working construction, and we were pouring a retaining wall in Amesbury.
It happened on June 23, 1988.
We were pouring it with a coal chute, and it was 16 feet long, and I went to lift it up and step up. And when I did, I ruptured 2 discs in my back.
This man, who's reluctant to have his name used, severed the nerves to his right leg, leaving minimal feeling. After going through several unsuccessful surgeries, he was put on painkillers that didn't work.
I was in bed for almost 22 years, and that was just getting up to do the minimal daily bathroom, you know, get a drink of water, and then that was it, right back into bed. I could barely move.
But now his pain is being managed at the Elliott in Manchester with opioids such as methadone and oxycodone, and now he can walk with a cane.
If you use the right medicine with the right dose, you get outcomes that are profound for the individual.
Dr. Gerard Heverin treats chronic pain syndrome, which affects about 11% of the adult population.
Chronic pain syndrome is actually a disease process, and when pain persists beyond 3 months, lives get changed.
In the last few years, Dr. Heverin has seen an increase in referrals from physicians who are unwilling to prescribe even minimal doses of opioids. New guidelines were put in place in 2016 for physicians who prescribe the drugs in response to the state's crisis. Under those rules, doctors can only prescribe opioids that are the equivalent of 100 milligrams of morphine daily.
Trying to ratchet down just the prescription of opioid pain medications is doing an injustice to many of these people because, first of all, many of them have gotten tremendous value and actually have functional outcomes.
Dr. Heverin uses the guidelines in a modified manner, but does not set opioid limits, prescribing as the situation demands, and slowly weaning stable patients down to lower levels, something he says he's been successful at doing over the last few years. And he uses opioid alternatives when possible.
I blew 2 discs and herniated, ruptured everything, and ended up bedbound at that point.
But now this patient says she can live a normal life with the use of a Butrans patch, a mixed opioid that has a very low risk of abuse.
I put it on once a week and forget about it. You don't even think about it, and I can literally function again. I have a function of life.
Outcomes Dr. Heverin says he will continue to fight for, and patients say they desperately need. Kristen Carosa, WMUR News 9.